Hello there, everybody. My name is Dr. Bryan Langlois. I'm the Medical Director and Staff Veterinarian at the Pet Pantry of Lancaster County. I've also been a member of the Pennsylvania Veterinary Medical Association for the past 9 to 10 years. And, you know, in my line of work, we see a lot of people that come to us here at the Pantry, a nonprofit, looking for help because they can't afford regular veterinary care. And one of the refrains we always kind of hear from time to time is that, you know, veterinary care is just so expensive, and that's the reason I can't really afford it. And I'm here to talk to you a little bit about the value of preventative care. And you'll notice I'm kind of standing next to a door here, and there's a reason I'm doing that. And because one of the biggest refrains and complaints that we hear from the public and people that are kind of a little hesitant to get yearly exams for their pets is that, well, my vet's going to charge me $50 just for walking through this right here, this door. I'll tell you something. That's really not true. You can walk through a veterinary's office door as many times as you want. You're not going to get charged a dime. Might get charged for trespassing if, you know, you're doing it for some other reason, but you're definitely not going to be charged money. The $50 is what we consider the average cost for basically a physical exam for your pet. And other people, you know, kind of say to us, and some clients who don't want to come in yearly basically say, well, I can look at my pet and, you know, it looks generally healthy to me, and I'm not going to pay $50 or whatever the exam fee is for, you know, basically my vet to turn around and say, well, he's perfectly healthy because I can see that as an owner. Well, you're not paying the $50 really, or whatever the exam fee is, just for your vet to basically say they look healthy. There's a whole bunch of areas that we as veterinarians look at to determine, to make that one statement. And while it may seem we're doing kind of a quick cursory exam or looking over your animal very quickly, there's a lot of things that we look for, and things that actually can help prevent issues later on down the line if we catch them early through a general physical exam. What kind of things am I talking about? Let me show you. So this is what your $50 is getting. I've listed some things here. When your veterinarian is doing a physical exam on your animal, we're looking at all of this. And we're looking for things that might show the start of a problem that might not be picked up until the problem progresses. So let's go through. Let's look at some of the things that the veterinarian, when they're doing a physical exam, will check out. First, we're going to start basically right at the head. We're going to move our way down to the butt and the tail. And so we start out with the eyes. Do they look symmetrical? Does it look like one pupil is bigger than the other? Does it look like there's any sign of infection? Any sign of irritation going on? Might there be some evidence of a neurologic issue that might only be picked up through the eyes? In addition, you'd be amazed at how many disease processes we can sometimes pick up on or notice that might be starting just by looking at their eyes, just by sometimes looking at their retinas, seeing for changes in their retinas, things like that. So that's a very important thing. Ears, move right on to there. Is there evidence of potentially a polyp? Is the eardrum intact? Does there appear to be any signs of maybe an infection brewing that's a little bit further down that we may not be able to pick up on until it gets a little bit worse? Is there any kind of evidence of allergy going on in the ears? So these are all things that we look at when we take a quick look inside their ears. Moving on, we go to the mouth, the teeth. Are there areas that seem painful in their mouth? Does it look like there might be a tumor starting somewhere in their oral cavity that you may not notice yet, but may rear its ugly head when it gets bigger and the animal has difficulty eating? Especially with cats, are there areas in cats' mouths that appear more painful when you push on their teeth a little bit? Is there evidence of what we call stomatitis starting in cats, which is an inflammatory issue in the mouth that we want to try to get ahead of before it gets really, really severe? Is there evidence of teeth missing? Is there evidence of tooth infection? Is there evidence of teeth that really look like they could use a dental cleaning to prevent further infection and potential pain in your animal? Does the jaw seem okay? Does the jaw have normal range of motion? Is there potentially a sign of something that's going to be starting affecting their range of motion in the jaw, which might affect their eating? Does everything feel okay as far as the mouth and the teeth go? So we look there. We move on down. We start looking at the neck. We're feeling for things like lymph nodes, any weird lumps, bumps, checking maybe pulses there, making sure there's nothing weird. In cats, definitely checking their thyroid, which sits in their neck, to see if there might be a sign that the animal might be starting with a thyroid condition or things of that nature. So we look at the neck. Move on down then, we start looking at the chest. First we just kind of again feel for any lumps and bumps. Do all the ribs feel okay? Does it feel like there's anything abnormal? In cats, you may actually see us squeeze the chest together because that's a sign of a healthy cat, is what we call chest pliability. If we cannot squeeze the chest together, that might be the sign that there's a problem brewing somewhere in the chest cavity, and we need to explore that further. And it may be something that you didn't even pick up on until the cat has a real problem breathing, in which case it's more of an emergency situation. Of course, we're going to sit there and we're going to listen to the heart and lungs. What are we listening for when we listen to the heart and lungs? Well, the big things, first of all, is to make sure that the beat is regular. So we're listening for any kind of abnormal heartbeats, or what we call an arrhythmia. We're also going to listen, for any signs of a murmur. And murmurs can basically be abnormal sounds that might indicate that there's a valve problem. And while it may not be anything super severe, in a lot of little dogs, we actually do see a fair number of murmurs that develop. But we want to know it's there, because this way we have something to go by and gauge. We also want to be able to know if we need to do further diagnostics or potentially start some medication. You as an owner may have never known that there was a murmur existing in your pet. Only your vet can pick it up by listening to it. So that's another valuable part of the physical exam that we do on your pet each and every time. The lungs, we're making sure that air is passing on both sides nice and evenly. Do we hear anything abnormal? Do we hear some wheezing? Do we hear, difficulty passing air? Sometimes in cats as well, we may notice a little bit of fluid developing around the lungs. Doesn't always happen, but you may not notice it in your cat. We may be able to pick it up by hearing it. So this is all things that we listen for. We move on to the armpit, the axilla area, and then we go down the front limbs. Again, feeling for any lumps and bumps, making sure there's no cuts, abrasions. Do the nails look okay? Do the lymph nodes that sit in the armpit area of your pet feel okay? Are there any other abnormalities going on there? Is there any limping going on? We'll watch for that as well. Front feet, big area with allergy in dogs. Is there evidence of any kind of problems going on in between their pads? Is there any kind of evidence of problems with their nails? Sometimes we can determine issues like if their nails appear more brittle, maybe there's a nutritional problem going on. So we're going to look at all that, making sure the nails obviously are not too long and causing problems and pain when the animal's trying to walk, things like that. We're going to move back up a little bit on the body, and we're going to go now down to the abdomen area. So we're going to look at their abdomen. Again, we're going to feel around any lumps and bumps on the skin, things like that. Are there any hernias that we might pick up when just feeling the abdominal area? Umbilical hernias are something that we pick up fairly frequently and sometimes need to be corrected, sometimes don't. But we've got to feel to make sure that that's okay. We're then going to take a good feel inside, and we're going to feel all the different organs that are in there. We're going to feel the kidneys. Do they feel like they're normal shape and size? Does the animal appear painful on any part of palpation that might indicate a problem? Does the liver feel normal? Does the spleen feel normal? We're going to feel all those things, and we're also, very importantly, going to feel for any masses or abnormalities in the abdomen that if we catch them early on a physical exam, we might be able to intervene with. Abdominal cancers and lymphomas, especially in cats, can be really, really nasty, and sometimes we don't pick up on them until the owner brings them into us when the animal's not doing well. And at that point, sometimes there's very little that we can do. But if you bring your pet yearly for a physical, you will have a vet that will find those things and be able to help you both save your animal's life potentially, as well as doing it at a much reduced cost as compared to when it comes in and it's a much more serious problem. So we look at that. For females and males, we'll feel their mammary glands, and we'll feel for any tumors, masses, things that feel a little irregular. Is there any evidence of mastitis, which is just inflammation of the breast tissue, especially in females, going on? We're going to move on. We're going to feel your groin area, not your groin, we're actually going to feel the animal's groin. We're going to feel their groin area. And we're going to see, again, is there any sign of hernias? Do their pulses feel okay? When we listen to their heart, we check their pulses, which fall right kind of in their groin area and a little bit down on the inside of their leg. We want to make sure the heartbeat matches the pulses. If it's not, there could be a sign of a little bit of a problem there. Again, I'm going to go on to their hind limbs. Everything we check with the forelimbs, we're going to check with the hind limbs. We're going to go in, feel for lumps and bumps, feel for abnormalities. We may feel their knees, make sure their kneecaps are okay and not popping in and out, which can happen on some smaller breed dogs. Again, we're going to check their feet. Make sure, again, same thing on the front feet, we're going to check for the hind feet. Any signs of lumps, bumps, scratches, scrapes, are the nails okay? All of those types of things. So we're going to look at all of that stuff. Go back up to the tail and the genital area and the butt area. We're going to check to make sure, again, are there any masses or anything that feels weird? We're going to check their anal glands. Does that feel okay? And make sure that those don't need to either be expressed or potentially becoming impacted. Does the tail feel okay? Is there a normal range of motion? Do they seem uncomfortable when you move their tail in a certain position or something like that? Those can all be signs of problems that we can pick up on. As I said, we're going to check all of their lymph nodes from head to toe and make sure that there's no sign of any enlargement of lymph nodes, which could be potentially the sign of a cancer or just inflammation somewhere that we have to, work up a little bit more. We're going to check their body condition and their muscle tone. We're looking basically for a well-muscled animal that is not too heavy, not too skinny. A lot of times now we're going on body condition, not just the weight and poundage of the animal. And your vet can take a look at them and make sure that they're in good body condition. Because sometimes, we may notice a little bit of an area that seems to be a little less muscled than others. That could be the sign of a nervous system issue going on, just maybe in that limb or an injury or something of that nature. And finally, as we look through all of this, We're going to look at the neurologic systems. We're going to make sure your animal's walking okay. There's no sign of what we call ataxia or staggering. Nothing in the eyes looks weird. All of the nerve reflexes are normal. So these are just some of the things, and there's 22 things here. 22 areas, that we check, and check very thoroughly when we do a physical exam. So it's not just us as veterinarians coming in and saying, your pet looks healthy. Good job. No, that $50 or $45 or $55 or $35, whatever the general exam fee is for a yearly exam, you are getting all of this checked. And you are basically having all of this looked at to make sure that your animal appears very, very good and healthy, and that we can find problems and correct them early. And myself personally working in the nonprofit realm, this is where I stress this the most, because we see the issues that people can't afford to take care of anymore because they didn't get the preventative care early. And I can't stress enough, just saving up a little bit. Really, if you saved $1 a week, the average cost of a veterinary exam is in the $50 range. $1 a week is all you have to save. And basically you can have a yearly exam done on your pet to make sure that everything's okay. So remember this, 22 areas. You're paying for the vet to look at all those areas, and also for the experience and expertise to know that all of those areas are healthy. Now, some people might turn around and also say, I don't need to go to the vet. I've got something like Dr. Google, or I can look something up on the internet. If my pet seems to be a little off, I'll just pop a search term in and I'll know exactly what's going on. Let me show you how Dr. Google cannot diagnose things in your pet. Here I am in basically our surgery and treatment area that we also do exams at here at the Pet Pantry. And with me is my buddy here, Weezer. He's a cat that's currently up for adoption at the Pet Pantry, but suffering from a little bit of a chronic upper respiratory infection. But I have Weezer up here for an important reason, and a lot of people think that they can now just go online or post a question on a forum and basically get their pet diagnosed, or that they can look things up on the internet that basically will allow them to determine if their pet is healthy or not. That is not the case. The internet is a wonderful resource. I myself use it several times a day in the veterinary field, looking up new treatment options or trying to get a little bit more information potentially on a disease process, seeing what the latest research out there is. What I won't use the internet for, and what you as pet owners really should not use the internet for, is for self-diagnosing problems in your pet and determining if your pet is healthy or not. Only a veterinarian can do that, because only a veterinarian has these right here, their hands. A computer doesn't. A computer cannot reach out and feel your animal, do the proper physical exam by touching and looking all over, that a veterinarian can. A computer does not, as of yet anyway, have the ability to kind of rationalize what they're seeing, determining if things are normal for that animal or not. They may be able to give you general information, and we call it Dr. Google just because Google is the most popular search term out there. But I'm going to give you some examples of exactly what I mean when I talk about this stuff. And using Weezer here, the first thing we're going to look at is just kind of him in general. We're going to look at his eyes. And his eyes look pretty good. There's no sign of major issues or things like that. Internet can't do that. You can't really plug your cat into the internet. Another example is just listening to them, listening to their chest, listening to their heart and lungs. We're going to do that, and he's so happy he's purring right now, so it's a little hard to hear things, but, there's everything, now that he stopped purring for a second, sounds okay. His heart sounds good. His lungs sound good. There's no signs of murmurs or arrhythmias, anything like that. I have my laptop over here. There's no place to plug one of these in and have the computer analyze exactly what's going on. So there's another area. Let's look, let's say, inside his mouth real quick. You might be able to get pictures of what a mouth looks like, but you're not going to know whether your cat necessarily has the same exact thing going on picture-wise that's going on in there. Only your vet, and again, with these, can determine that. Finally, to give an example, I'm going to feel his abdomen. Everything feels good, no masses, nothing like that. And it's important to remember that, again, only veterinarians can do this. And they are the ones with the expertise to figure out exactly what feels normal, what doesn't. Again, no hands on the computer. Nothing that can come out like this that can feel the animal, feel for lumps and bumps, figure out if things look normal or not, look in their ears, look in their eyes. So the internet, again, is a great resource. Thank you, Weezer. And it's a wonderful thing to use. However, for making sure your pet is healthy, and making sure that there are no problems or things that need to be further diagnosed. Only humans, us as veterinarians, can do that. So that's why you'll hear me often say, and this will be a tagline that you'll hear refrained all over the place, take your pet to the vet, not the net. Now, we're going to look at one more thing, and I'm going to show you why spending that small amount of money on a physical exam to catch things early will, one, definitely help your pet, but two, help your wallet. Welcome back to the whiteboard. So let's take a look. I know a lot of people are concerned about the potential monetary expenditures when it comes to doing a physical exam on your pet, and I just wanted to show you guys some numbers as to exactly how you may be saving money. So let's look. The average, as we can see, physical exam probably falls somewhere in the $50 range. I mean, that's considered average as far as that goes. Let's say we find a small problem with the ears or something like that. We might be able to correct it, for as little as, depending on what needs to be done, cleaning, medications, things like that, maybe an extra $100. Let's say that you don't bring them in, year after year, and this ear problem that you've noticed and maybe we're trying to treat at home with some home remedies, or that you looked up on the internet and said, just do this, do that, is allowed to kind of fulminate for a while. And the treatments help a little bit, but since we're not necessarily getting to the root of the problem, we're just kind of treating the symptoms, there's underlying things that are going on in the ear canal that chronically change the nature of the canal and things like that. And then eventually, maybe a year or 2 years later, you notice that there's a really bad odor. Your pet just seems really, really uncomfortable with what's going on with their ears, and you bring them into the vet, and the vet looks at it, and unfortunately, when you get to that point, there's not a lot medicine-wise we sometimes can do in those situations. What you're looking at is, because the ear canal has become so infected and so scarred, is a surgery to alleviate your pet's suffering. That sometimes is the only thing that can be done, where we go in and we have to actually remove a good chunk of the ear canal because it's just so inflamed, so infected, and so scarred down. So instead of that $100 that you maybe would pay to kind of nip the problem in the bud, as well as talking to your veterinarian to see what things you might be able to change to prevent it from happening again, you're now looking at a surgery that's somewhere in the area of maybe $3,000. Big difference there. What, 300%, 3,000% increase maybe? So look at these things. A lot of people look at dollars and cents and what they can afford and what they can't afford. At $50, a year, it seems a lot better than having to shell out $3,000 for something as severe as an ear infection. Might even be higher, if we can't, examine your animal on a yearly basis, pick up a small maybe mass or swelling in the abdomen that we're not quite sure what's going on. We biopsy it, we find out that, and for a biopsy, okay, let's look at this. Let me grab my trusty eraser. Pop that out. Let's say you've got your $50 exam fee. And, for a biopsy, maybe, of a mass, let's say it's not in the abdomen. Let's say it's a small little mass that we find on the skin. So a biopsy maybe will run you $150 to $200. Average. Now, every vet's different, depends on how they do it, but let's just say straight, even if we just look at straight costs, that's what you're looking at. Now, you ignore that mass for a little while. Instead, think, I've looked up a picture on the internet. It looks like it's probably a benign cyst. That's what it feels like according to what I'm reading. I don't really have any concerns with it. 2-3 years later, all of a sudden you notice that, that mass is getting bigger, and maybe I should have it checked. You have it checked. Now we look at it, and instead of maybe spending $150 to $200 to see, it's something we've got to take off now to take care of, you're looking at a large mass that now is potentially spread areas, and again, you're looking at a surgery that may be in the $1,500 to $2,000 range. Factor of 10, factor of 20, factor of 25. So if you're even looking at these things from a dollar and cents standpoint, having your pet examined on a yearly basis, one, helps save their life in a lot of situations. Two, saves your wallet, because it's something that's so incredibly easy, to do to help catch things early. And three, prevents you from having to make very, very difficult decisions sometimes. And those decisions can be as severe as deciding you have to unfortunately euthanize a loving member of the family because it's something that you can't afford to treat at this stage. And sometimes you're contacting a veterinarian like myself that works more in the nonprofit sector. Sometimes we can help out and work things out, and sometimes we even can't because things have just gone on for a period of time. So keep all of these types of things in mind when you're weighing that $50 exam fee, and when your vet calls you up and says, I want to, see your animal on a yearly basis. It's really important that you come in just to catch things and see if they're done properly, and making sure that that physical exam is carried out in a proper manner to find things before you're looking at a $1,500 to $2,000 bill. Here we are back at the door that leads to your veterinarian's office. As we kind of explained before, it's not going to cost you $50 to walk in and out of it, but when you look at what that $50 or $35 or $45 can get you, both in peace of mind and health for your animal, health for your wallet, it doesn't seem so bad to come through with your pet once a year now, does it? So remember, take your pet to the vet, not the net, and take them at least once a year. Establish that relationship with your local veterinarian. Your pet, your family, and your wallet will thank you.